Hello, hi everyone. So this is the second part of the lecture regarding teeth selection and arrangement of the complete dentures. In the first part, we discussed about the selection of artificial teeth, selection of the anterior teeth, selection of the posterior teeth, depending on the various factors. So coming to the second part, in which we'll be talking about the arrangement of teeth in complete dentures. So on. These are were the learning outcomes for this presentation for you guys. And moving on to the introduction. Following the selection of the artificial teeth, determining the type of occlusion the artificial teeth are arranged. Now, the arrangement of teeth is dictated by setting principles of individual teeth, anatomical landmarks, dentogenic concept, etc. The ridge relationship, arch form, and the need to arrange teeth in balanced occlusion also influence the arrangement of the teeth. The two teeth should occupy the potential space, that is the space between the cheek and the tongue and the lips. So this is essentially termed as the neutral zone, that is the teeth are in a balanced relationship between the cheek and the tongue without pushing against each other. So, coming to the various factors that influence the teeth arrangement, they may be namely anatomical landmarks such as incisive papillae, rugae, the canine prominence, the label freedom, the buccal freedom, all these things. And Fresh and Fish also briefly discussed about the how teeth arrangement can be characterized in males and females, but these concepts are very old and they are beyond the scope of this lecture for you guys for undergraduate syllabus. Third is the arrangement of the teeth based on ridge relationship. That is, how do you arrange teeth in a class 1 ridge relationship, in a class 2 ridge relationship, and in a class 3 ridge relationship. So next on, first, depending on anatomical landmarks of the residual ridge, the maxillary teeth are positioned labeled to the ridge. Even the maxillary anterior teeth as well as the maxillary posterior teeth are positioned slightly labeled to the ridge. That is, they fall labeled to the that is a mandibular teeth. So they have a overjet from beginning from anterior teeth to the posterior teeth. And the mandibular teeth, on the other hand, they are arranged on the crest of the residual ridge due to the resorptive pattern of the mandibular ridge, which is in a medial and lingual direction. So what ha- in so what happens is with edentulousness, the mandible increases in size and the maxilla decreases in size, because in the maxilla the resorption is from the label side towards the midline, whereas in mandible it is from the midline to toward the outside. So the mandibular teeth are arranged on the crest of the ridge with the central fossa of all the mandibular teeth in line with the crest of the resorbed residual ridge. So this is how an anterior ridge relationship or the anterior teeth positioning of the maxillary and mandibular teeth on a complete denture is seen in the edentulous. Now the lingual cusp of the maxillary posterior teeth should be centered over the mandibular ridge, and the mandibular anterior teeth should not be set too far from the center of the ridge. So if this is the center of a resorbed mandibular ridge, the mandibular anterior teeth will be at or just level to the crest of the mandibular anterior ridge. They cannot be placed too far anteriorly because the action of the orbicularis oris muscle and the mentalis muscle will push or create instability in the denture. Whereas the maxillary teeth are set slightly labial or facial to the crest of the maxillary ridge, because maxillary is resorbed and is smaller in size, and also at an angulation of 15 to 20 degree to create an overjet. Now, moving on, the lingual cusp of the mandibular posterior teeth should not encroach on the pound line. So, what do you mean by the pound line? Pound line is a line drawn from the lingual border of the retromolar pad in the mandible to the mesio lingual line angle of the mandibular cuspid. So, this is an imaginary line given by Pound, and he said that the mandibular posterior teeth should be set in such a way that they do not encroach upon this line. So while setting the mandibular posterior, that is the bicuspids and the first and second molar, they should not encroach upon this line, especially because this encroachment will result in the loss of stability and retention of the denture because of the tongue space. So this space is needed for the tongue, and as you know, in long-standing edentulous patients, usually after 1 to 2 years, the tongue is enlarged in size because there are no teeth holding it back. So we have to take extra care while the alignment of the posterior teeth. Moving on. Next, coming to the arch form. Now, a square, as we know, it's just the same as the facial form. The arch form is also classified as square, tapering, ovoid. We have gone this over in the previous lecture. In the square arch form, the arrangement is almost a straight line. That is, there is only slight curvature of the mandible, maxillary, anterior teeth. The curvature is very gentle, as if the maxillary incisors are set in a straight line, that is from canine to canine, without much rotation. The full face of the maxillary anterior teeth are visible in when the patient smiles, giving a broad effect. This is generally for older individuals, especially males. And next is a tapering arch form. In a tapering arch form, the central incisors are placed much forward as compared to the canine. So you can see it is as if the central incisors have been pushed forward. The lateral incisors, the lingual line angle of the central incisors is much pronounced facially as compared to the distal lingual line angle of the central incisors, and the lateral incisors follow this curvature same as the central incisors. The lateral incisors are also rotated and raised from the occlusal plane, and they are depressed at the gingival margin. That is, the cervical margin of the lateral incisors is more towards the wax or towards the gum, and they appear more proclined in a tapering arch form. In a ovoid arch form, the arrangement has a definitive curvature and the central incisors slid slightly forward to the canine. Not as much as the tapering arch form, but definitely forward to the canines. There is not much rotation of the canines because an ovoid or arch does not require too much lingual inclination of the distal line angle of the canines. So there is a gentle rotation of the all the anterior teeth from the canine to canine following the ovoid arch form. So next, coming to the ridge relationship. Depending on ridge relationship, the teeth arrangement is primarily done. That is, this is the main factor depending on which the teeth arrangement is carried out. All the other factors such as arch forms and the anatomical landmarks, all these things are secondary to the ridge relationship. So teeth arrangement differs based upon the class 1 ridge relationship, class 2 and class 3 ridge relationship. Coming first to the teeth arrangement in a class 1 ridge relationship, which we generally encounter, the first teeth to set is the maxillary central incisor. The long axis is inclined slightly towards the vertical axis when viewed from the front, and the incisal edge is flush in contact with the glass plate, that is occlusal plane. The maxillary teeth are also set at a 15-degree angulation when viewed from the side, that is, they are slightly sloping. That is why the maxillary rim also has a slight proclination at the time of the jaw relationship. This inclination is necessary to ensure that there is a proper overjet between the maxillary and the mandibular anterior teeth in a class 1 relationship, which is generally we have to keep around 2 to 3 mm of overjet. Now coming to the arrangement of the lateral incisor. Lateral incisor is arranged with its long axis slightly towards the midline. That is, we tip the lateral incisor slightly so that the incisal edge is more leaning towards the midline of the maxillary wax rim, and the cervical part of the lateral incisor is slightly sloping distal. So this is set at 1 mm above the occlusal plane, that is, in a glass plate relationship, the lateral incisor will be 1 mm above the glass plate and not touching it. The distal surface of lateral incisor will follow the curvature of the arch, because we have to keep in mind that we have the anterior teeth will determine the curvature of the arch. So starting from the lateral incisor, the canine, their distal ends have to be tipped in such a way that they follow the curvature of the arch form, whether it is square, tapering or ovoid. So we can see the distal line angle of the maxillary lateral incisor is slightly tipped to follow the curvature of the maxillary arch. Next, coming to the canine. Canine also is slightly, it is, although in the frontal plane it appears vertical, but it is also slightly tipped so that the cervical part is leaning more distally. Only the tip of the maxillary canine is touching the glass plate. The maxillary central incisor and maxillary canine are both touching the glass plate. The cervical margin of the maxillary canine is more prominent when compared to the lateral incisor. In the canine, because of the canine prominence, the cervical margin of the canine, cervical part of the canine is pushed more outwards. So it appears as if the canine is tipping or slightly retroclined, and this will be more prominent in people with a tapering arch form, whereas in people in what you call square arch form, the cervical prominence is kept less. So coming to the arrangement of the mandibular anterior teeth, again first the mandibular central incisor is first set following the midline of the upper wax rim, and it is kept vertically parallel or at perpendicular to the occlusal plane. It is slightly above, the incisor edge is kept 2 mm above the occlusal plane of the mandibular wax rim to create a overbite with the maxillary anterior teeth. The lateral incisor similarly is also set 2 mm slightly above the mandibular occlusal plane for the sake of the overbite, but the lateral incisor is slightly tipped towards the midline, as you can see by this line. Coming to the arrangement of the mandibular canine, in the mandibular canine similarly is also set 2 mm above the occlusal plane of the mandibular wax rim, and it is also tipped towards the midline, and the cervical part of the mandibular canine is more prominent, that is it is pointing more facially as compared to the incisal edge. As you can see over here, this is a complete set of the maxillary mandibular anterior teeth on the articulator. So we can see here the cusp tip of the maxillary canine should be in line with the distal incisal line angle of the mandibular canine. So this will ensure that we get a proper class 1 key of occlusion for the posterior teeth, that is specifically the first molar. So now moving on, coming to the posterior teeth arrangement of the maxillary first premolar. The maxillary first premolar long axis is parallel to the vertical axis when viewed from the front and as well as from the side. The buccal cusp of the mandibular first premolar is the only cusp that is contacting the occlusal plane. The palatal cusp is slightly above the occlusal plane. As you know, this is following the reverse curve or the anti-monsoon curve. The buccal surface of the premolar is in line with the labial surface of the canine. As we can see here, the labial surface of the canine, the first premolar are in line with each other and will follow the curvature of the arch form. Maxillary second premolar similar is also arranged in line with the buccal surface of the canine first premolar, but the difference here is that both the buccal and palatal cusp will contact the glass plate. From a occlusal viewpoint, the buccal surface of the first and second premolar are in line with the labial surface of the canine. Next, coming to the arrangement of the maxillary first molar, when viewed from the side, the long axis will be sloping distal, that is following the curve of P, which we know is a sphere which is 8 inches in diameter, which was a curve of and with its center at the glabella. And this curve passes through the anterior border of the ramus of the mandible to the rotating center of the condyle. So for that sake, the maxillary first molar is arranged in such a way that it appears to be tipping distal, and only the mesopalatal cusp of the maxillary first premolar will be contacting the glass plate, and the other cusp are not touching the glass plate. And again, it will follow the same the buccal surface of the both the premolars. Next, coming to the arrangement of the maxillary second molar, as I said, the maxillary teeth arrangement will follow the curve of Spee and the curve of monsoon, and depending on the rotating center of the condyle of the patient. So here again, the mandibular second molar is also set with the, when viewed from the side, it appears to be tipping distally, and but the difference is that the mesopalatal cusp of the mandibular second molar will not contact the glass plate, but it will be the closest to the glass plate. The second molar on the occlusal view appears to be slightly tipped buccally and distal. So as you can see, this is the curve of fee that all the maxillary teeth have to follow from starting from the canine. Now coming to the arrangement of the mandibular first molar. After the arrangement, after finishing the arrangement of the maxillary anterior teeth, mandibular anterior teeth, then we finish the arrangement of all the maxillary posterior teeth, and then we first establish the key of occlusion with the mandibular first molar. So the mandibular first molar, the long axis is leaning slightly lingually when viewed from the front and from the side. All the cusps are at a higher level above the occlusal plane than those of the second premolar and the first premolar. The distal cusp will be slightly higher because in the maxillary first molar also it is tipped distally, so the distal cusp of the mandibular first molar will be slightly higher than the mesial cusps. The mesiobuccal cusp of the maxillary first molar should rest in the buccal groove of the mandibular first molar. This is called as a key of occlusion. It is very important to establish this early so that the we get a proper relationship with the first and second premolars. So this is how the premolars are arranged. They are arranged in line with the buccal surface of the first molar and the canine, and they are there is minimum overjet between the posterior teeth, and the teeth are arranged in such a way that the central fossa of the mandibular posterior teeth is on the center of the crest of the mandibular ridge. The key of occlusion of the mandibular second molar is also similar to the key of occlusion of the maxillary and the mandibular first molars in the class 1 ridge relationship. Now, coming to teeth arrangement in a class 2 relationship, as we all are aware, in a class 2 relationship, the mandibular appears more retrognathic, or is it when the mandible is severely resorbed, whereas the maxilla appears slightly prognathic. This results in a very large overjet of 5 to 6 millimeters. As a result, the anterior teeth are set similar to the class 1 arrangement, that is following all the glass plate relationship and the contour of the ridge, but the difference is here there is an overjet of 56 mm compared to the class 1 ridge relationship or teeth arrangement in which there is only an overjet of 2 to 3. So as a result, there is less space to arrange the mandibular posterior teeth. In this case, we may have to remove one of the premolar. That is, we remove the first premolar. That is after the canine, directly the second premolar, and both the molars are set. And this is essentially what is the difference in a class 2 relationship. Also, there is an overbite of 2 mm is kept. Coming to the teeth arrangement in a class 3 relationship, in a class 3 relationship, the mandible is more pronounced or more prognathic, that is larger in size than the maxillary ridge, which is severely resorbed, resulting in a smaller maxilla. As a result, there is hardly no overjet. That is, the anterior maxillary and mandibular anterior teeth are set in such a way that they are edge to edge, which literally zero overbite, like that is we call as edge to edge bite or scissor bite, and as a result there should be minimum vertical overlap or the overbite of the maxillary and mandibular anterior teeth, so that the mandible and the maxilla can move freely in protrusive movements. Of course, here the maxilla is smaller, so we may have to eliminate again here the first premolar in order to set the teeth anterior to the tuberosity, and or we may, if there is some amount of space, we can trim the maxillary first premolar distally, that is to reduce its width, and then we can arrange the maxillary second premolar, the first and the second molars. So that brings us to the end of the teeth arrangement. Arrangement of the artificial teeth plays a pivotal role in the success of complete denture, and it is not a mechanical process performed on a device, but needs to be correlated with the various biological factors as well as the aesthetics. Thank you all for a patient hearing.